you very much for this kind invitation. The topic to me is the hepatitis elimination, the way forward. I'm thankful to Gates Pharma and my colleagues to give me this opportunity. As said by Professor Muzaffar Latif Gill, the World Hepatitis Day is one of the WHO's 7 officially mandated global public health days. It is named World Hepatitis Day and is held annually on 28 July, which is the birthday of Dr. Baruch Blumberg, who discovered the hepatitis B virus in 1967, and 2 years later, he developed the first hepatitis B vaccine. These achievements culminated him winning the Nobel Prize. So that's the reason this is the 28th July is held as the World Hepatitis Day. The target audience for this talk is the doctors, from primary care physicians to consultants. There will be stuff for our nursing and paramedical staff as well. Some food for thought for government officials, as well as for the society key opinion holders and general public. So in my talk, there will be switch off mode of the themes and talks to very simple to a high technical one. So please bear me out with that. We all know that the hepatitis is one of the major health problems in the world. And the causes for this hepatitis, they are the viral hepatitis, which are named from A to E, A, B, C, D, and E. We all know this. And all these, they can result in damaging the liver, the healthy liver, extremely, and leading to liver failure. But we know that the common causes of the acute liver failure are hepatitis A, B, D, and E. These are the worldwide. In addition to causing the acute liver failure, what they can cause, especially the hepatitis B, C, and D, these are 3 ones who can make the healthy liver through acute hepatitis to chronic hepatitis, resulting in the liver cirrhosis when the liver is shrunken, and ultimately the liver cancer develops. So these problems we do see in clinical practice: cirrhotic patients with hepatic encephalopathy, with bleeding, they vomit blood, the hematemesis melena, the ascites and its complications, the liver cirrhosis, the cancer, as well as the hepatorenal syndrome. So these are the complications of chronic liver disease and cirrhosis, which we see. And the chronic liver disease, we'll see later on, is one of the major mortalities in the world. If we take the hepatitis A, it caused approximately 7,000 deaths in 2016 around the world. Almost everyone recovers fully from hepatitis A. This is a good point, with a lifelong immunity. Very small proportion of people infected with hepatitis A who die from fulminant hepatitis. We all know that a safe and effective vaccine is available to prevent hepatitis A. It is transmitted through ingestion of contaminated food and water, or through direct contact with an infectious person. The risk of hepatitis A infection is associated with a lack of safe water and poor sanitation and hygiene. Safe water supply, food safety, improved sanitation, hand washing, and hepatitis A vaccine are the most effective ways to combat this disease. Coming to the another orophycal route hepatitis, that is the hepatitis E. It caused approximately 44,000 deaths in 2015 around the world, 440,000 rather. Every year, there are an estimated 20 million HEV infections worldwide, and it leads to an estimated 3.3 million symptomatic cases. A vaccine to prevent hepatitis E virus infection has been developed and is licensed in China, but it's not available everywhere. Just like hepatitis A, it's also transmitted through fecal-oral route. principally via contaminated water, and that's the reason we see the epidemics. Hepatitis E is found worldwide, but the disease is most common in Southeast Asia, India, Pakistan, Kashmir, and here. Safe water supply, food safety, improved sanitation, hand washing, these are the most effective ways to combat this hepatitis E. Coming to the hepatitis B, C, and D, 325 million people today, they are living with the viral hepatitis B and C. 219 million, that means 9 out of 10, the dilemma is these patients that don't know that they have got this hepatitis B or C. This is a big chunk. And that's the reason the theme for this World Hepatitis Day is find the missing millions. Annually, 1.46 million people die. It means 400 deaths per day. It is transmitted through injections, blood transfusions, surgical interventions, tattooing, ear and nose piercing, sexual route is another one, from mother to child in case of hepatitis B. We all know that a safe and effective vaccine is available to prevent hepatitis B. And that's the reason the hepatitis B vaccination is one of the components of WHO Eliminate Hepatitis program. Disposable syringing from injections, safe blood transfusion, safe surgical procedures, tattooing, ear and nose piercing, safe sexual HPV vaccination and prevention from mother to child, these are the effective ways of prevention of hepatitis B, C, and D. Why there was need to launch the hepatitis elimination program? The reason is in 2013, this is the mortality report by WHO. This is the patients dying, the green is the from acute hepatitis A, B, and E. And then this is the number of deaths, 4 lakhs around from B serotics and C serotics. And on top of this, these are the deaths from the hepatocellular carcinoma. So in total, in 2013, around 7 lakhs from hepatitis B, and the same number, rather a bit more than that, was a patient died from hepatitis C. This is 2013 report. And in 2015, in the second report, again, very huge mortality from hepatitis B, hepatitis C, cirrhosis. So that's the reason. And this is another graph, the data of WHO from 2000 to 2015. This is the red is the HIV mortality, and now this is on down slope. This is the tuberculosis mortality over years going down. This is the malaria mortality over years going down, but hepatitis mortality was rising. That's the reason in 2015 and 16, the WHO properly launched the elimination. In 2015, UNO included hepatitis in its sustained development goals. And in 2016, the World Health Assembly adopted the Global Health Sector Strategy on viral hepatitis to eliminate hepatitis from the world by 2030. And the goals of this Global Health Sector Strategies is to reduce hepatitis incidence from 6 to 10 million cases to 0.9 million cases, and to reduce the annual hepatitis deaths from 1.4 million to 0.5 million by 2030. This is the more simple graph to understand. This is the reduction in the new cases by 90%. In 2020, it's around 30, but by 2030, the reduction should be to 90%. And the deaths, it's from 10%, the reduction should be to 65% reduction in the deaths by these hepatitis by 2030. And how we will achieve? If we achieve that 90% of people infected are diagnosed, as I said before, only 10% they are diagnosed. So if the total 90% are diagnosed, and if the 80% of those diagnosed, they are treated, and 90% coverage and vaccination, and 100% of blood products are safe, and 90% injections, the health facilities are safe. If we can achieve these targets, this will be achieved. So this is the in lump sum or in nutshell the goals of the WHO set for the world countries. Just to understand the global hepatitis elimination, this is a model to make it understand. This is the hepatitis pool in the world, and this is the source of infection, reinfection for the non-infected people. So they enter the pool, and the people, they go out of this pool, they exit the pool either by the cure in hepatitis C or controlling the disease by hepatitis B, or they die. So how to reduce this from this big pool to this one by 2030? We have to have two strategies. One is elimination by prevention. So we prevent the entry of the new patients into this pool. And second is elimination by cure. So we cure more and more patients, either cure or we make them virus controlled or free in case of hepatitis B. So this pool will shrink down and will be lowered down to the desirable level. These are the two components of global hepatitis elimination program. So one is the cure, one is the prevention. In the cure, as I said before, that this is what is the current situation, that out of all infected people, this fragment is tested. This is their condition is stable. These are included in care, and only this almost 20 or less than 20%, they are followed up. So what we should do, proper testing, linkage to care, then the treatment and the chronic care, and the prevention will go side by side throughout the whole this last 1 decade. On the cure side, 4 main components: blood and injection safety, harm reduction, 3 doses of hepatitis B vaccination, and prevention of mother to child transmission of hepatitis B. So these are the components of global hepatitis elimination model given by the WHO. And this is the situation that B vaccination is good. From mother to child transmission is less than 40%. Blood safety, many countries, they are following this injection safety. So if I transmit this into more simple words, in 2015, the B vaccination will be increased from 84% to 90%. Similarly, the mother-child transmission, blood safety, injection safety, and all these things. WHO is regularly monitoring. They produce the document in 2015, 17, and then in the 19. What's the global progress? In 2017, the 135 people, they responded to this program. 84 countries, they had reported that they have got the hepatitis national plan, and 62 countries reported that they have got civil society engagement. And as February of 2019, the number of countries with national plan is really increasing. It is now around 130. So this is a good global progress. And this is a very important slide. Those countries who have engaged civil society in their national action plans, they're performing better as compared to those where only the governments, they are doing it. So we should engage the civil society in this. What is the way forward? This is the most important point. As I said, keeping this model, we have to put our efforts on both ends. An elimination by prevention side, safe injections, safe blood transfusions, safe intervention, the surgical interventions, dental interventions, gynae procedures, safe sex we should promote, and HPV vaccination. These are the 5 main components we in Pakistan as well as globally we should work on it to achieve these targets. Coming to the elimination by cure, we should make the testing available and reliable to each and everyone at the doorstep. The linkage to care is important, and we should augment the healthcare system. We should improve the healthcare system. The treatment should be affordable, and it should be, the people should adhere to it. And the chronic care of the surveillance and prevention, these are the 4 main components on the cure side, which we should need to implement and into our national program. The affordability is one of the major hindrance in getting all patient tested and treated. Every patient has the right that he should be linked to the testing, to the care, and to the treatment. So this is very, very important. And this is where the government and the civil society can join hands and work on it. So to elimination by cure, it has got two main components: treat the known cases, and I already said how, reduce the barriers, to develop ancillary skills and services, linkage to local community-based organizations, benefits, consider counselor for patients, pharmacy in the hepatitis clinic should be there, and identify new cases. The World Health Alliance, No Hep, all these have adopted the slogan, find the missing millions. And this is very, very important. As I said, around 90% of people infected by hepatitis B and C, they don't know that we are having this infection. So find those millions. This is already, I said, 90% of HBV, 81% of HCV people, they are unaware of the disease. Many years ago, I published one article, how to make the Pakistan hepatitis free. And I had suggested two main ways of the screening, and still it holds good. One is the mass screening. Mass screening is that on the first phase, you screen the high-risk people. High-risk people, those people who live in the highly prevalent areas, those people who live in the areas or in the families where hepatitis B or C has been found. These are the people who by profession are at the high risk. So screen them. And when you screen them, you found them, you link them to cure. And if they are negative, so vaccinate them for hepatitis B. Second phase, people residing in the high prevalent areas, and rest of the general public will be the third phase. And second is mandatory screening. Mandatory screening at the time of admission to school, making NIC, making passport, going for employment, going for out a journey like Hajj, something like that. So we have to find these missing million by these methods, by mass screening as well as by the mandatory screening. And mass screening will be in the first phase high risk, then the second phase, and then the third phase. So I understand and I believe that the elimination by cure and find the missing millions, it is not a job of an individual or any organization by its own or the government by its own. This is a joint effort. Until and unless the government, the organizations, the individuals, the civil society, they are on the same page, they've got the same targets, they've got the same thinkings, it will be impossible to find the missing millions and go for and strive for the hepatitis elimination from our country. And I think this is the way forward, that we should go for those 80 to 90% who are knowing, who don't know, and we don't know that these are the patients of hepatitis B or C. Thank you very much once again for giving me the opportunity to share my thoughts to you on this topic. And now I'll stop my share and I'll give my mic to the moderator. Thank you very much.